Hello, I'm Esme Murphy, and this is Talking Points. I'm going to be taking a look at why indicators show healthcare costs are increasing at the same time that healthcare access is decreasing. Some analysts say the potential collapse and closing of one of Minnesota's largest hospitals is a canary in the coal mine moment, pointing to a snowballing cycle of higher costs, fewer insured, and fewer places to get care for patients throughout the state. The hospital in question is Minnesota's Hennepin Healthcare in downtown Minneapolis. It's a safety net hospital, which means it treats everyone regardless of their ability to pay. Last year, the hospital treated 115,000 patients and saw 94,000 emergency room patients. It lost an estimated $36 million. But they are not the only ones in trouble. 30% of Minnesota hospitals last year lost money, and the outlook beyond this year is even worse. Medicaid cuts in 2027 are expected to kick 140,000 Minnesotans off of Medicaid. At the same time, premiums on the individual market are scheduled to increase by 21%. All of these things point to a dire situation for both healthcare providers and certainly for patients. Joining me to take a look at this concerning situation is Dr. Rahul Koranne, the president and CEO of the Minnesota Hospital Association. Thank you so much
for
coming here. All right, is it a canary in a coal mine moment with Hennepin Healthcare? Because a lot of people look at it and say, you know, it's a hospital in downtown Minneapolis that doesn't have anything to do with me.
It absolutely is. And it's not just Hennepin Healthcare, it's also the hospital next to it, North Memorial, but it's also 31 hospitals across the state of Minnesota are financially distressed. So I'm a physician, a primary care physician, and I've worked in hospitals for almost 30 years in Minnesota. When you have these many symptoms happening at the same time, it's absolutely a crisis. These are symptoms that are telling us that there's a structural problem in how hospitals are getting paid. The math is not mathing up.
Right. And the math keeps not mathing up, and it sort of snowballs geometrically. I mean, it just keeps going up and up. What is the basic problem here with Hennepin Healthcare and the model that you have here? Because I know that, and that's the place where many people who go are not insured.
Yeah, so it's the same math problem for Hennepin Healthcare, North Memorial, and these other 31 hospitals. On average in Minnesota, about 60 to 70% of the patients the hospitals serve are on Medicaid or Medicare, so government payers. Those two payers, governmental payers, are not paying up to the cost of care being provided. So Medicaid is only paying 68 cents on the dollar of cost. Medicare is only paying up to 80% of the dollar on cost. So if almost 60 to 70% of the patients, or let's say customers, because I want your viewers to understand how this business works. So if almost 70 to 75% of your customers or patients, their payers are not paying up to the cost, how are you going to keep yourself solvent? The only way to do it is to expect the commercial payers to pay more, which is why all of our bills are going up. It's all connected.
And they are continuing to go up. You also mentioned before we got started that there are 31 hospitals across Minnesota outside of the metro that are in trouble, including 2 or 3 that may not be able to make payroll. What is going on there? I mean, that's a very serious situation.
Yeah, it's the same exact issue of how healthcare is being paid for in this country. And it's not that we don't have enough money in the healthcare industry. The money is just going to the wrong places. So I sometimes think of this as a tank where the nonprofit hospitals, and thankfully almost all of the hospitals in Minnesota are nonprofit or not-for-profit, so they don't have shareholders. They really exist to serve their communities. So these nonprofit hospitals are like fish swimming in this tank, but there are for-profit sharks that are eating them alive. So who are these for-profit sharks? We call them the middlemen in healthcare that we don't really talk about because none of them actually have humans that touch us as patients when we go in. So these are the pharmaceutical companies, the trillion-dollar for-profit pharmaceutical companies that are making billions in dollars of profit. These are pharmacy benefit managers, these are for-profit insurers, these are large technology and IT companies that are siphoning off all the profit, leaving the nurses and the physicians and the actual healthcare providers like HCMC and North with no money left.
What percentage, roughly, for a hospital like HCMC is getting people who are not insured at all?
Yeah, so the uncompensated care, so this could be people that have high deductible insurance and just can't afford the $5,000 deductible, or these could be people that just don't have insurance. HCMC in 1 year, and they're very public about this, they had $100 million of uncompensated care. That's a big number in 1 year for one hospital. The same story is in all of our hospitals across the state.
Okay. There's also another hit coming in 2027, although it might be coming, I understand, in the fall as well, in terms of Medicaid cuts in the big, beautiful bill that could basically kick 140,000 Minnesotans off of Medicaid. That's going to be a big, big deal, isn't it?
Yeah, and the way we are talking about it now to try to explain it to our lawmakers, both here and in Congress, is we are facing two hits. We are currently in the middle of an earthquake. So the Jenga tower is already shaking. We don't have money now. Some hospitals are thinking they might have to close within the next couple of weeks. That's the earthquake. What you're talking about, the big bill, the HR1, that impact starts in October of this year.
Okay.
That's the tsunami. So let's make it through the earthquake and brace for the tsunami. It's two hits.
Okay, if things continue as they are, what does this mean for the average person who does have health insurance, who maybe lives in the suburbs and has access to, Fairview, Southdale, or some of the great hospitals we have in the suburbs? Will they eventually feel the hit as well?
Everybody is going to feel the hit. You and I, and everybody is going to feel the hit because all of our costs are going to go up. As government does not pay its bills through Medicaid and Medicare, the only way for these hospitals to survive is to pass that cost on as a hidden tax to employers and to others. So my message to lawmakers right now, because they're in session right now, is we have policies in hand that we're bringing to you. Hospitals in Minnesota need lifelines, not any mandates or cuts.
What has the reception been for, there's kind of a novel proposal to bail out HCMC, which would mean repurposing the tax for the Twins ballpark, increasing it slightly, and having the proceeds of that tax go to Hennepin Healthcare. Have you found people receptive to that? I'm not going to ask you to predict the vote or whatever, but...
Yeah, I know that, the board is very actively thinking with the new interim leadership that they named yesterday.
But it needs the legislature's approval.
But it needs the legislature to discuss, and then also it needs to look at what are the needs from HCMC, what are the needs from North, what can the legislature support. Yesterday, we had a very robust discussion about healthcare in the Senate on the floor. And I'm proud to say that we had bipartisan support on one of our top priorities this year, which is lawmakers in Minnesota need to stand with nonprofit hospitals in healthcare in Minnesota and not with these trillion-dollar pharma companies that are putting ads all across the state saying, choose big pharma over nonprofit hospitals. That just can't stand.
All right. In terms of the hospitals situations and the potential for hospitals closing, what we're also seeing is major clinics. Like the Mayo Clinic, for instance, had clinics in Belle Plaine, Caledonia, Montgomery, Northridge, which is North Mankato, St. Peter and Wells, shut down these clinics. Where do those people go? And that leaves an enormous hole.
Exactly. And, talking about another, service line that has been on the front lines and in news throughout the last couple of years is labor and delivery, for example. We are the second state from the top in the number of labor and delivery programs that hospitals have been forced to close. 19 hospitals in the last couple of years have had to shut down their labor and delivery services. Those moms, if they can find an Uber or a Lyft or can afford a car, they will have to drive now to birth babies. Why is that happening? It's happening because the financial structure is broken.
Okay. Let me just ask you this really quickly. Do you think people get it and understand that everybody's costs are going to go through the roof here?
Well, thank you for having me here. I am a physician. I worked in the smallest hospital in Minnesota. Which was in Starbuck. It closed in 2005. So I've been there and done that. Minnesotans need to know that no matter what insurance you have, you may have the Cadillac plan. If the local clinic or the local hospital was forced to shut down, your access just went away.
Okay. Well, listen, Dr. Koranne, thank you so much. Obviously, words of warning here, and it's all around us, and we will be following this story.
Great. Thank you, Esme.
Thank you. And that does it for this edition of Talking Points. As always, please email me with questions and comments at esme@cbs.com. Thank you so much for watching. I'm Esme Murphy, WCCO News.